So, hi. Have you ever wanted to change the course of history? I mean, you could be leaving a legacy for your children and your grandchildren. So, Amazon and Google have legacies, and they're known as disruptors of the marketplace. Bill Gates has a legacy, and he's known as contributing to the demise of polio. But all these three have the same problem, and it's called the last mile. So how do you deliver goods and services the last mile? How do you deliver the polio vaccine the last mile? And how do you re-educate people about a disease that they thought was long out of existence? So I was visiting my eldest son in Papua New Guinea during his gap year, and our whole family was there on a fantastic opportunity with YWAM medical ships for about 3 weeks. Youth with a Mission ships is similar to Mercy Ships of Africa, and they partner with the World Health Organizations, local governments, local businesses, and people like you to deliver health care to remote areas in the South Pacific like Papua New Guinea, the Philippines, Indonesia. And some of these people that they serve have never seen a dentist before in their life. This is my daughter. Some have never had a chance to be immunized against preventable childhood diseases. Some don't know simple hand washing techniques that can prevent diseases. And this is a twin of mine. I mean, they totally put you to work on this ship. It was amazing. So all of these people, you know, we need to deliver the goods, the services, medical supplies, education, and manpower, that last mile. Sometimes the only way you can reach it is like that last, trip on the canoe. So if you've been to a national meeting like this one, sometimes at the AAD you want to introduce physicians that could benefit from collaboration with one another, or a resident that would benefit from learning from an expert in his field. And it's up to you to facilitate this introduction. You could be a catalyst for the solution to a worldwide problem. So this happened to me recently because I was speaking with a group of Rotarians, and I asked for people who could be resources to me and enablers to come speak with me after the meeting. And someone like you came and reached out to me and told me about a resource right in Atlanta that I didn't even know about in my backyard. So I'll tell you more about it later. But I also wanted to ask if you've ever been in a situation where no one believed you. I mean, I felt like Columbus saying the world was round, people thought he was crazy. So this happened the first time I was on Youth with a Mission ships. I was the first dermatologist they'd ever had. So you and I, we see things like a dermatologist would, through dermatology eyes. That's how we evaluate things. So this was my first patient. She had traveled for 2 weeks in her canoe, paddled to see me because there was a skin doctor on board. So she'd been treated for a sunburn for 15 years. Well, I explained that I needed to do a biopsy for confirmation on the diagnosis, and I need your all's help. What's a diagnosis? What's a differential for this? What are some of the things you think about? Come on, you're dermatologist. You can tell me this. Come on, shout it out. What do you think? Leprosy, lupus, something infectious, weird BCC. Well, it turns out that when I asked her to do a biopsy, she physically dug into her nose with her fingernails right then and there and handed me a piece, or tried to hand me a piece. No anesthetic, no nothing. Now, do we have a better diagnosis? So it turned out that her grandfather had leprosy. And leprosy had been eradicated from Papua New Guinea at global eradication levels of 1 to 10,000 since 1990. But the thing is, no one could even find the form on the ship that I could fill out to refer her for treatment because no one believed me. So these are some other people that I saw, some other patients. But remember how I talked about introducing people and collaborating. So it turns out that the Leprosy Mission International had been in Papua New Guinea, and they had never been to the places where the ship had been. So my simple introduction was fostering a new partnership to take us into the next century. The most amazing thing is that the World Health Organization gives medication to treat leprosy until it is cured and eradicated in that area for free. So this is the medication that they give out. I think it may be Order of St. Lazarus that does the medication. But we're not isolated anymore in the United States. There's 150 new cases yearly. In my hometown of Atlanta, there's 3 new cases a year, and about 20 cases that are followed by Emory University Leprosy Clinic. So we're not reinventing the wheel. We're basically trying to connect existing well-established organizations. We're connecting people and local healthcare workers with education, re-educating them about thinking about leprosy and starting treatment. We're providing that last mile. So if you want to know how to work on your legacy, if there are any of you out there who like to take exotic vacations, this is it. YWAM is incredible. They will find something for you to do. My husband is doing an EMR for them, and my son is interested in ophthalmology right now. Never was before. My daughter's thinking about something in healthcare. Who knows what the twins are thinking right now? But it's an amazing opportunity. So if you are an enabler, if you have resources that you can share with me, please come and speak with me after the meeting. If you want further information about volunteering on the ship, my email is on atlantaskin.com. There's some links to volunteer on the ship. There's movies that are on there about things that we saw when we were there. So please remember, atlantaskin.com. Atlanta, y'all, South, Emory. Thanks so much for the opportunity to talk to y'all.